My name's Robert. I'm a social worker for Hertfordshire and I work in a family safeguarding team. I wanted to do the training because it would be very useful for the role that I'm in. As a social worker working with families, including young babies, it's kind of hard to work with families to let them know how their behaviours affect young children, and sometimes it can be hard to evidence that. So using something like the infant mental health training and building on my understanding of child development, of attachment and things like this can really show parents from an objective manner how their behaviour affects children. I got out of the course a really good understanding of how a child develops, of brain development, of the influences of family, the importance of caregivers, and really, for me personally, it gave me a lot of confidence in working with families, in working with young children, because although I'm a social worker that works with a range of families, child development is not my speciality. So for me, it gave me a boost of confidence. Having done the training, I felt that I got a better understanding of children that I was working with who are a little bit older, and it gave me a bit more background about how they might have developed and what might have led to them kind of displaying the behaviours that they were displaying and things like this. I just found the course very helpful, to be honest with you. It's really helped me as a social worker get a better understanding of child development as a whole. It's informed my writing, it makes it much more evidence-based and my work much more objective, and has helped me engage with families in a way that I haven't been able to before.
I'm Jan McEwen. I work with the intensive support teams. I took the course in the first place because I work all the time with whole families, and I see the impact of mental health in all sorts of directions, really, not only children's mental health but parents as well. And so I was really interested in it, wanted to just expand what I knew, really. At the moment I don't work with any expectant parents, but I think that the benefits are quite far-reaching, really, in terms of I work a lot with behaviour. And I work with quite a lot of parents who struggle with challenging behaviour from their children, and I think often you can track some of that behaviour from early years distress. I think the course has made me think more about how that can be tracked and how that information can be shared with parents. And actually, when parents realise that there's a cause for some of the challenging behaviour they're experiencing, and they can see a kind of reason behind it, it helps them to understand and actually to empathise more with what the child's going through or what the child might be feeling. And actually then often it changes their approach to that child, and also it changes the way that they think about things, and often I can see that the relationship improves as a result, and things can change from that. Sometimes it's not just the parents themselves, but it's other people that take responsibility for children. So sometimes grandparents who are have children placed in their care, and they know that the children have gone through traumatic times, but they can start to understand the behaviour in relation to those traumas that the children have experienced. And actually it does make them more resilient in dealing with that behaviour when they can understand a bit about where it's coming from, and they can understand a bit more about how they can approach it. Yeah, I definitely recommend it. I think it's a really good course. It brings a lot of different strands together, because I've known a bit about attachment and sort of different things around that, and I've known quite a bit about behaviour, but it brings a lot of things together for me around biochemistry of sort of like antenatal life and postnatal life, and stress and trauma and what's actually happening to the baby.
My name's Tracy Oliver. I'm a staff nurse from Thumbswood Mother and Baby Unit. I work in Radlett. Our unit provides care for mums and their babies after they've experienced mental health issues, either post-delivery or for the year after. We get mums that may have had pre-existing mental health problems, or we get mums where it will be their very, very first experience of any mental health issues. So quite a diverse age range and cultural background. Our priority is to kind of help mum to recover to meet the optimum level in terms of her mental health and her ability to look after baby. It's only kind of more recently that we've started to look at how baby is within that whole picture. So the key thing that I took away from the training is the importance of the relationship between mum or their parents and baby, because we'd always been focused more on the maternal mental health, and that relationship, although a lot of us have worked here a lot of years and we know lots of things about that relationship and how mental health can impact on that relationship, actually having the knowledge behind that and why things happen and what we can actually do to improve the outcome for mum and baby's future mental health as well. I think in this area you do have to be sensitive, because for a lot of mums there are already issues around their relationship with baby and they feel very guilty about, you know, possibly the emotional care that they can give, so you have to be quite sensitive. But if you do it in a way that you can promote those positive experiences and, you know, just let them know about a child's development rather than kind of, you know, picking up specifically on issues within their own relationship, I think you can work with that. But again, you have to be kind of sensitive about that. For me, this course, it just opened my eyes to so many things. So I've come back to my area and I've actually recommended that all the staff that work on Thumbswood have access to this course, and we've actually started by training. 2 of our nursery nurses have now actually completed the training, and we're working on getting all the staff. I just think it's something really, really important that all people that work with children, we're all on the same page, we're all working towards the same outcome in terms of infant mental health. You know, this is our future. These are the people that we will be coming into our services in the future. So if we can step in at an early stage and recognise and work with babies, toddlers, you know, working through the age ranges, it would be fantastic.